Okay, Prof, can you see my screen?
Sorry, what program are you using? You can go full screen?
Okay, it is on a full screen, right, Prof?
No, I can. Or is it, you're using a website? Is it?
Okay, hold on. Then let me.
Can you download it? Download it to your computer and open it as a not from the website, because you're opening it from the website. It's PDF from the website. So open it with computer PDF.
Okay. Is it visible now, Doctor? Hello, Prof?
Is visible now? Can you show? Can you just show as full screen? Go to view full screen. No.
Okay.
All right. Okay. Thank you.
Okay. All right. You can hear me clearly, right?
Yes. Can you hear you clearly? Please continue.
Okay. All right. Okay. Good morning to Prof. Victor and also dear classmates. So we are going to present about case study 3, topics on the etiology, clinical features, prevention and management of hand-arm vibration syndrome, also known as HAVS. So my team members would be myself, Abirami, then Edwin, and also Hasana. There's 3 of us. So talking about the introduction, so when we are talking about hand-arm vibration syndrome, definitely we need to know about the causes itself, so which is the human vibration. So definitions of vibration, definitely vibrations is experienced by human body as a result of direct contact with vibrating surfaces. So when there is a vibrating surfaces and when human have direct touch on those surfaces, then the person will be experiencing vibration. And it divides into 2 different categories of the whole body and also hand arm. So today we are focusing more on the hand arm vibration. So talking about hand arm vibration syndrome, it is a common occupational disease that affects workers in a lot of industry, in multiple industries. It is often experienced as a sensation change of the fingers, muscle weakness, bouts of white finger, and main reason would be working with vibrating tools. So the employees who works with vibrating tools would be experiencing hand arm vibration symptoms. And on the side of the screen, you could see some images that the employees could be experiencing at the first stage and moving on to the middle stage. So this is the introduction. Moving on, I would like to talk about some statistics with regards to HAV as an occupational disease. So according to SOCSO, HAVs has been recognized as diseases caused by vibration. So disorder of muscle, tendons, bones, joints, peripheral blood vessel, and peripheral nerves, which have seen increased from just 34 in 2010 and to 160 in 2015. So there's 2 things. One, perhaps in 2010s, there's not much of an exposure to the disease itself and very less awareness of people seeming it as an occupational disease. Next, moving on to like 2015, probably there's a more occupational exposures to have as an occupational disease. So this is a statistics that I managed to obtain from one of the slides that Prof. Victor have prepared before, because the reason SOCSO website have provided a report, but it's a report from 2018. Now the recent case have increased from the last case in 2015 here, it was 708. Now it have been too much increased to 1,151, which majority of the cases were from male workers compared to female workers. So 752 just contributed by male workers. So just a statistics for your viewing. So moving on, I would like to talk about the 3 different components that we could see when it comes to hand-arm vibration symptoms. So we could see it from a peripheral neuropathy perspective, where it is involving the nervous system. So this is literally involved, this causes changes of sensation in the fingers, which could lead permanent numbness to the fingers, muscle weakness, and in some cases, so it could lead to the white finger. And at a long term, some research papers have been also suggesting that this could be a primary contributor for carpal tunnel syndrome as well. So it affects the nerves of the fingers due to the vibration. It could be damaged and it could be compressed. So next one is more on a vascular point of view, which is called as the Raynaud phenomenon. So this is where the obvious white fingers could be seen. So this is called as the connective tissue disorder. And it is due to the injuries of the hand, prolonged vibration, and some other contributing factors such as smoking, your existing medical issues such as thyroid problems and certain medications could further lead to this syndrome. Okay. Then moving on to next one would be more from the musculoskeletal point of view. So it is literally the painful inflammations of the tendons could cause temporary neurosensory effect and definitely a more of a permanent musculoskeletal diseases or disorders. So the employee could be seen more weak, having discomfort, pain of the hand, wrist, forearms, and elbows. So it is a very beginning stage of hand-arm vibration syndrome. The next one is we're going to see what would be the causes of this hand-arm vibration syndrome. So it is literally, as I explained, occupational exposure to the vibrating tools. The primary risk factors is it is the 1,000 hours of employees spending on the intense vibration from tools such as chainsaw, impact tools, grinders, and jackhammers. So we have put up some images that is relevant to hand-arm vibration syndrome, that employees would be using the hand tools or tools that causes a lot of vibrations. So the other contributing risk factors could also include age factors, if you are a heavy smoker or not, pre-existing medical conditions that could cause or lead to neurovascular pathology. Next, I pass to Hasana.
Hello and good morning, everyone. I'll continue the presentations from here on. Okay, let's move on to the clinical features. Clinical features are actually divided into these certain components, which are vascular component, neurological components, and also musculoskeletal component. So based on the vascular component, due to HAVS, our finger color changes. For instance, we call that as blanching. What is blanching? Is actually a temporary obstruction of the blood flow in that particular area. So this blanching actually causes the color of that particular area to become more pale, and also it causes our finger to become more cold. And next, moving on to neurological component, we will experience finger tingling and also finger numbness. And towards the musculoskeletal component, we also will have problems in our upper limbs, and it can cause bone cysts and wrists and fingers, for instance, leading towards osteoporosis, and also our hand grip weakens. So there are a few clinical examinations for HAVS, which is abnormal dexterity. What is dexterity? Is actually our skill in performing certain tasks, especially with our hands, and also abnormal light touch sensation, and also abnormal 2-point discrimination. What is the meaning of 2-point discrimination here is the ability to discriminate two nearby objects touching our skin at 2 distinct points. And next slide. Okay. All right, so the development of this HAVS is gradual and it also increases in severity of time, and it is something that it takes a few months or even years for the symptoms of these HAVS to become clinically noticeable. So this is an illustration of the stages of the HAVS from mild to the severe stage. All right, I'll just run through the staging and grading. So this is the Stockholm Workshop scale for the classification of sensorineural effects of the HAVS syndrome. So here we have the stages from 0 till the third stage of sensorineural, and these are the related symptoms of each stages. And as for the grading, we are being staged from 0 till the fourth stage, and they are being graded as mild, moderate, severe, and very severe.
Okay, I will be presenting about prevention and management. HIVS is a chronic and progressive disorder, and there is no effective treatment or cure. Therefore, prevention and management are very necessary. And usually, treatment is directed at removal from all exposure, increase peripheral circulation, compensate of sensory loss if required. Next. There are several preventive measures can be taken. First is vibration exposure reduction at the tool. Purchase tool with the lowest vibration possible. Exposure limit lower than 5 meter per second square over 5-hour shift. Action level 2.5 meter per second square. Also, the vibration level can be measured using hand-arm vibration meter. And we can have modification on tools as well, such as adding AV handles. And we have to ensure regular maintenance for tools and replace old and worn out equipment. And as for vibration exposure reduction at the workers, provision of AV gloves that is waterproof and windproof to keep hand, arm, and body dry and warm. Also, the AV gloves must meet the standard ISO 10819, and the frequent short breaks can be introduced. For example, 10 minutes away from the vibration tools, as well as the task rotation. Next. Second is promoting good working practices among workers. Workers have to keep fingers and hands away from cool exhaust air while using pneumatic tools. Pneumatic tools is using compressed air. Also, workers have to use tools correctly by avoiding excessive gripping, avoiding to use tool longer than necessary. Also, have proper clothing. Tight clothing will result in poor blood circulation. And third is avoidance of medication that can make circulation to fingers become worse. For example, beta blockers, medication for high blood pressure and heart problem. Also decongestants because it contains adrenaline, migraine pills, for example, propanolol. Also oral contraceptive pills. Next. As for HIVS management, there are several management such as drug management, non-drug management, and prognosis. For drug management, as we mentioned before, there are no effective treatment or cure, but there are several medications can be prescribed. For example, calcium channel blockers, such as nifedipine. It can be prescribed for severe cases to improve peripheral circulation. Pentoserfaline. Pentoserfaline is a medication to help blood to flow more easily through the narrow arteries. Also in anti-inflammatory medications such as aspirin for pain management. As for non-drug management, elimination of the vibration exposure or redeployments, reassignment tasks to workers, also avoidance of cold exposure to keep finger, hand, and body warm and dry, as well as the working environment, smoking cessation, because the chemicals inside the cigarette nicotine will constrict blood vessels and result in poor blood circulation. That is why smoker has more severe circulatory problem and slower recovery. As for prognosis, HIVs may be reversible in early stage, but in advanced stage, HIVs usually does not improve but progress, even though the exposure has been removed completely, and surgery is contraindicated. Okay, thank you. That's all.
All right, thank you very much. A very, very interesting presentation. Is there any question from your colleague? Any question from the colleague? Okay, no. All right. So basically, if you look at it, hand-arm vibration syndrome give you two separate problem. One is basically neurological. One is vascular. Vascular will give you what we call the redox phenomena, where you get a white finger. All right. So hand-arm vibration syndrome is basically it's called white finger, where the finger become white because of decrease in blood flow, because of the damage to the small blood vessel. So damage to the small blood vessel, if you got diabetes also, you get damage to the small blood vessel. You're smoking also, you get damage to the small blood vessel. So basically diabetes and smoking will basically complicate the hand-arm vibration syndrome of vascular nature. So basically you get what we call a decrease in blood flow and decrease in what. So the finger will become white, and then after that, basically there will be necrosis, and basically you get necrosis, and you get the finger become dark, and that's where it can drop off. So necrotic stem finger. All right, this is more of a okay. The other symptom is your neurological symptom, where damage to the nerve, and mostly sensory. All right, so it's more sensory than more muscular. Sensory means that you have a decrease in sensation, like what was pointed out is basically 2-point discrimination. So 2-point discrimination is where you basically look at basically very simple. You just take your compasses and just make 2 point, and then see whether you can have 2-point discrimination. So those are the decrease in sensation. The vascular component, you don't see it much in a hot country like Malaysia. Why? It is because your hand is warm, so it is very, very difficult to see the vascular component here. That means patient don't come in complaining that they got vibration white finger. They don't complain of that, but they do complain. They basically have decreased sensation. They will complain of that, because sensation itself is basically present in both cold country and warm country. So to diagnose basically what we call vascular component in Malaysia or in any other country, is usually what you do is you put the hand of the workers in the cold water, ice water, and then the fingers will turn white. Usually when you put in ice water, normal hand, you won't turn white. All right. So vibration white finger. Can you show the table, the SOXO table, please? This now SOXO table. Okay. All right. So this statistic is not for hand-arm vibration syndrome. This statistic is for vibration diseases, which basically can be caused muscle tendon and bone joint. This is basically more for musculoskeletal disease. So this is not for vibration disease. So no need to. We don't have so much vibration disease in Malaysia. That means we have vibration disease, but don't have so much vibration white finger in Malaysia. All right, because of the problem of basically we don't get vascular complaint. So the neurological complaint is difficult, and usually people don't come and complain of decreased sensation. So unless we do what we call medical surveillance, we wouldn't be able to diagnose the vibration white finger or diagnose the neurological component. So this table is basically for occupational diseases. Where do you get this table?
Prof, I got it from one of your lecture actually.
Then why there's MSOHD there?
Occupational MSOHD. Which one, doctor? Oh, that one. Okay, I just put the, actually, I was doing some research from their website as well. So I got to know there is a Malaysian Occupational Health Doctors Association.
Right.
And
Okay.
they were releasing some data as well. So I just put that logo there.
Okay, but basically the vibration, there's not so much vibration illnesses, huh? Maybe
Yes, yes.
34 and 160. Correct. I don't think there's so many. All right. So